Assalamualaikum warahmatullahi wabarakatuh. So today we'll be learning about the anatomy of the humerus bone, its presenting parts, and also the anatomical points. So let's start. So this is the humerus bone. This is the typical long bone. So it presents the upper end, the intervening shaft, and also the lower end. So in case of upper end, so there is head. So this head is rounded. There is the constricted part, neck. So this is the greater tubercle, and this is the lesser tubercle, and in between two tubercle, this is the intertubercular sulcus or bicipital groove. So this was all about the upper end. So now coming to the lower end. So lower end, there is two part, that is articular part and non-articular part. So in case of articular part, there is the trochlea and there is the capitulum. So in case of the non-articular part, there is medial epicondyle, so which is more prominent, and this is the lateral epicondyle, and there is three fossa. The most prominent fossa is olecranon fossa, which lies posteriorly, and there is anteriorly, there is the coronoid fossa above the trochlea, and there is the radial fossa above the capitulum. So this was all about the lower end. Now coming to the shaft. So in case of shaft, there is three borders and three surface. There is anterior border, medial border, and lateral border. So we need to know the extension of these borders. So in case of the anterior border, the extension is from the front of the greater tubercle, we see the front of the greater tubercle, to the lower end of the humerus between the coronoid fossa and the radial fossa. Now let's move to the medial border. So the extension of the medial border is from the tip of the medial epicondyle to the medial lip of the intertubercular sulcus. And the extension of the lateral border, it extends from the tip of the lateral epicondyle and close to the middle of the shaft. This border fades away by the lower end of the spiral groove, and further above, it extends behind the posterior limb of the deltoid tuberosity and is continuous with the posterior aspect or the posterior margin of the greater tubercle. Now let's talk about the surface. It has three surfaces: anterior medial surface, anterior lateral surface, and posterior surface. So in between the anterior border and the medial border, there is anterior medial surface, and in between the anterior border and the lateral border, there is anterolateral surface. So in between medial border and the lateral border, there is the posterior surface. So now coming to the side determination. So we'll place the head medially, and the prominent olecranon fossa, this will place it posteriorly, and the prominent medial epicondyle will lie medially. So now coming to the anatomical points. This is the left-sided humerus. So round the articular head is directed medially upwards and backwards. The intertubercular sulcus or the bicipital groove lies anteriorly. Olecranon fossa, it lies posteriorly, and anterior surface has two fossa, radial fossa and coronoid fossa respectively. So this was all about the presenting parts and the anatomical points of the humerus bone. I hope you like it. Thank you.